There we go.
Here we go. Okay, my name is Greg Davis, and I'm chairperson of the Government Relations Committee. And we do have a quorum. We have a committee of 4. And so we have Dr. Yeager, and we have Mr. Stevens, and we have myself, and then Dr. Knox will probably join us in a little bit. I know that before we get started, we have to, I'm calling the meeting to order, but we have to have a motion.
To approve the agenda?
Yes.
So moved.
Do we have a second to approve the agenda?
Second.
Okay, all those in favor, raise your hands. Okay. Well, that was John. Hold on one second. Yeah, John.
You might need the passcode. This one had a passcode.
Oh, really?
Yeah.
You might know what the passcode is?
It didn't ask me for one. That's interesting.
I can send him an invite.
Yeah.
Log in.
Okay. Hey, John.
Oh, is he in? Okay, good.
Yeah, sorry. I was searching for the link.
Okay. Well, we just called the meeting to order. Do we have a motion to approve the minutes from last time?
So moved.
We have a second.
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 Okay. All those in favor?
Aye.
Aye.
Those who weren't here last month, we had Paul Chambers here, and we talked about communication. We had the county officials, and we had Paul Chambers, and we had Mr. Bradley, and to discuss internet coverage for the county. So that's what we talked about last time. This time we're going to be talking about our current situation in terms of the COVID, and kind of projecting into what the future looks like, particularly around January. I've had the opportunity to have a conversation with Dr. Daniel, and she has a lot of stuff to share with us as to what they're doing now, and we can project that out. I've gotten some written material from Allison in PR for UGA, but we've got 2 professors here, so they kind of know what's going on at UGA anyway. And so they don't have a whole lot to do in terms of this coming, to say about what January looks like yet, any more than they already have. And I know that Professor Adams, you've got to leave at 5. So I was going to go ahead and have you introduce yourself, and then Dr. Daniels can introduce herself, and also in terms of Mr. Henry. So those are our 3 guests, and so with no more ado, I was going to turn it over to Professor Adams. If you could just kind of give us an update about where you think we're at right now, and projecting into the future.
Okay. Greg, could you give me a little bit more clarification on what you mean by where we think we're at right now? Do you mean in terms of the cases?
Yes. Yeah. In terms of the cases, and if there seemed to be a little confusion, at least on my end, about whether or not there's a slight increase right now or not, and where you think we're going to be at when, if this, what we know about the flu season, and perhaps because we're all taking extra precautions, perhaps the flu season will be minimal this year. I don't know.
So I'll start just by introducing myself. So, Greg, thank you for inviting me. I got the invitation late yesterday afternoon, so I apologize in advance because it's not a formal presentation by any means, and I don't have anything pre-prepared. But I am in the College of Public Health. My name is Grace Bagwell Adams. I am on faculty in the Department of Health Policy and Management, and I also am the Assistant Dean for Outreach, Engagement, and Equity in the college. And one of my main projects is the Athens Wellbeing project that I'm the principal investigator of. And so Clark County School District has been a partner since the beginning in Athens Wellbeing project. And that is our effort at collecting, analyzing, and sharing data on population health and other outcomes in the county. And as far as COVID goes, it's really difficult to project. I mean, right now, what do we see? We're still at over 5,000 cases. We are still adding cases, though not nearly as fast as we were in the end of August and very beginning of September. One of the things that's really difficult about measuring this disease is the way that testing occurs. So there are two basically kinds of tests, antigen and PCR, and the Georgia Department of Public Health counts the PCR test as the diagnostic test, and that's the actual number that you see counted in the total number of cases in Clark County. But the Department of Public Health in the state has recently started counting and sharing some of the antigen test data, and based on what Dr. Amber Schmidtke has shared, who is a public health microbiologist who does a lot of coverage on the pandemic in Georgia, we do have a lot of antigen positives, and especially in Clark County. And so that's something to pay attention to. Even though those numbers aren't counted in the PCR diagnostic test, we do have positives in the antigen tests, and those tests are the rapid tests that still detect active virus in the body. And even though they're not counted in the total in terms of the DPH diagnostic numbers, it's something that we should pay attention to. So we've seen those data become really available. As far as what we're concerned about with flu season, it's really an issue of both co-infection, which is worrying about people getting the flu and COVID at the same time. And it's an issue of worrying about the overburdening of the healthcare system, because flu season is already, even in the absence of a pandemic, is usually very burdensome for our healthcare system, and especially for our hospitals when we get into the winter months. So you can imagine why that is a concern when it comes to COVID, because if we already are expecting, of course, additional pandemic cases and hospitalizations as a result of that, if you marry that with the fact that we'll have a natural uptick because of flu cases as well, then the likelihood that the system can become overburdened in terms of healthcare, especially the number of hospital beds we have, is higher than it normally would be in the absence of a pandemic and a flu season. So I don't really know. I don't think anybody knows what's going to happen. And what I think the concern is that we're seeing some nation and statewide trends ticking up again. The latest thought, of course, is that we kind of hit the bottom of that lull in case decreases, and we're seeing again increases in cases and hospitalizations. Deaths, on the other hand, take some time to catch up. So that's just a really quick cursory overview. And, Greg, you mentioned, because of the precautions, will the flu season be any different? Public health experts are hoping, of course, that people who are adhering to public health guidelines, such as mask wearing, being really diligent about washing their hands, social distancing, that will also mitigate the spread of regular flu. And that if that happens, that our flu season might not be as bad as normal, but there's nowhere to tell at this point. So I wish I had some more concrete, I wish I could tell the future. I can't. I'm just kind of looking at the trends about what we're seeing right now. And, one of the concerns that public health experts have is that with the impending holiday season, with families traveling and getting together, that of course the virus transmission will increase as a function of that. And because of the colder weather, with families being more likely to gather indoors, that we will see increased transmission relative to what we're seeing right now. And, we're coming up on Thanksgiving, Christmas holidays. So that certainly is a consideration that public health experts and epidemiologists are thinking about right now when we think about future caseload. And I'm happy to take any questions. I don't know if I'll be able to answer them, but that's just a quick snapshot.
I mean, one question that I have, Professor Adams, is that do we have testing readily available, and is it being maximized to the degree you think it should be?
That's a great question. So I keep a close watch on local testing options. One of the things that I have
He's
done
not going.
with some folks in the College of Public Health is come up with a list of local testing options in Athens, Clarke County. Anecdotally, I was hearing lots of reports in August of it being difficult to get access to a test very quickly, and that the turnaround time at that time was longer than it really should be. In some cases, 7 to 14 days for getting the results, which from a disease mitigation standpoint and containment standpoint is almost useless when it comes to the spread of this disease. Since then, my understanding is that it has gotten much better. I understand that the Department of Public Health at this time is really does have more widespread availability of tests, and then if you call and set up an appointment and get tested, most folks are getting their tests returned pretty quickly. I know that the surveillance testing at the University of Georgia has been really on top of getting people tested and getting those results back quickly as well. Of course, I understand that is limited to the University of Georgia community, but because UGA is embedded in Athens, that's an important consideration. So yeah, I think that there have certainly been times when we saw the last summer peak where the testing capability was strained, and that is a concern, and it needs to be a diligent point of focus for policymakers and for our healthcare system to continue to make sure that we have access to tests, and specifically rapid testing, as those new technologies are approved by the FDA, such as the saliva test. But it's at this time, my understanding is that it is better than it was. I don't know that it's perfect. I still think that we need to worry about low-income families, especially those who don't have insurance or access to transportation, in terms of getting access to the test when they need it quickly. But my understanding is that right now the testing capability is certainly better than it was at its peak when we were at our case peak in August. Dr. Yeager.
Has anyone asked you your opinion about our returning to school in face-to-face on November 9th?
No
And
one yet.
Are you willing?
Is that a question you're asking me now?
If it's all right with Dr. Thomas, I would like to ask that question.
I'll wait for Dr. Thomas's blessing before I.
Go ahead.
Yeah, I mean, I think, first of all, it's always really important for me to say that whatever views I express on this call are my own, not the College of Public Health, it's not the University of Georgia. It's undoubtedly a really difficult balance to strike. There is no perfect answer, and there's no real good solution. And I think the most important thing that all of us can do is to remember those that have the least access to the resources that they need to thrive in school and to thrive in general. And so the two groups that I worry about when I think about what I know from the Athens Wellbeing Project data, and when I know about Athens Clarke County in general from studying population health for the last 6 years, are the homeless and transitional individuals, and certainly those who don't have access to the food that they need, and really to internet at this point. So those are the groups that I would worry about the most. I'm not really going to speak to what I think about the district's current plan, because to be quite honest with you, I don't know enough about it to give you a full assessment. My child's very young and not in Clarke County School District, so I'm not super familiar with the plan at this point. But what I can tell you is that the groups that I think should be priority are those that are, again, the ones that don't have access to what they need to be able to thrive in a virtual environment, and in particular, homeless and transitional individuals. And my specialization is in policy and in health policy. And one of the things that I'm really passionate about, and one of the things that continues to emerge from public health evidence and community health, is that we should avoid a one-size-fits-all approach. And we should also avoid comparing ourselves to other communities, because we are very unique in Athens Clarke County, especially relative to the contiguous counties around us. And so the only advice I have to offer at this juncture is to really look at our own community, look within ourselves, and for the, for leadership to really consider the local aspects of Athens Clarke County and the most vulnerable among us in making the decisions. because that's, that's really all we can do at this point. I know that's really difficult. I don't envy the position that any of you are in, and I understand that the decisions are difficult and that children are and families, then the health and the educational outcomes are dependent on your decisions. So I respect your work and I respect your roles. And so because of that, I won't pass judgment on any decisions you're making right now, but I would just advise to really take a localized, tailored approach based on what our community looks like, and to consider the fact that we have a significant population of homeless and transitional children, and that is likely the highest priority group in terms of vulnerability if you're worried about education and population health outcomes. And I would kind of start there. I hope that helps, Dr. Yeager.
That does
Thank
very
you.
much. I
We
appreciate
have
that.
consulted with people in your department, and we have talked daily to DPH and CDC and members of your department staff and other agencies as well, in trying to carefully vet this decision and next steps. And it's interesting you brought up homeless, because we've met for 4 hours today, and that was one of the groups that we talked a lot about, and those who are in transition. So
Thank you, Dr. Thomas. And I also just want to say I've worked a lot and spoken a lot with Amy Roark, and I just have a tremendous amount of respect for her and the rubric that was created as evidence-based. And you really have a really good team of clinicians there and nurses at CCSD, and I think that her leadership has just been tremendous. And so I have been paying close attention to her advice as well, and just commend her, and thank you also for taking such a collaborative approach and thinking about consulting with the people who are here to help. And the College Public Health will continue to be here to assist in however we can.
What I would like to do, because I see a lead in for Dr. Daniel to come in. If you could, Dr. Daniel, if you can introduce yourself, and then particularly pick up on the experience of Athens Tech with students, young people who are virtual learners, and those in the brick and mortar, and whatever research you've got in terms of what we talked about today. And
well, thank you for asking me to attend. I greatly appreciate it. I want to begin by stating I'm Andrea Daniel, president at Athens Technical College, have been president going on 5 years, but have been at the college for 24 years. And as you all know, there is no manual that I could pull out and look at about what to do about a pandemic. However, as Dr. Thomas said, and I want to applaud Dr. Thomas, she has worked diligently. She and Dr. Barnett and the school system has worked diligently with our college to provide our dual enrollment students that partner through the Career Academy the opportunity to continue to do that as seamlessly as we can make that possible. And what I want to share, I want to piggyback. I am not a medical doctor or epidemiologist or virologist, but like Dr. Thomas, I really feel appreciative and a close kindred with the CDC and DPH, because we speak to them so often, and they provide great advice. I'm fortunate to have a very close friend who works as a director at the CDC, who's both an epidemiologist and a virologist, and she gives me a lot of good information. And so the background, our college serves 11 counties, which includes Clark County, but we have students that travel to our college from 93 counties. So we are constantly looking at the entire surrounding area, and quite frankly, the world. Someone asked about the flu season, and I don't know what that will bring, but I can tell you we've already had a flu clinic that VP Henry organized on our campus, because Australia is ahead of the US and they just finished their flu season, and it was the lightest on record. And when I read what they attributed it to, it was the flu vaccine, the social distancing, the masks, and hand sanitation. That a lot of that, to me, we've had a lot of emphasis on masks, and I'm right there with everyone, but we also have worked to teach all of our faculty and students about hand washing. So I do want to share with you some things that we've learned And we do not mirror the school system. We're very different. We have about 8,000 students that attend each year from 93 counties, but we have many students from Clark County that we greatly value, and we greatly value the Career Academy partnership. And so when the pandemic occurred, we had to, of course, transition to online, and we did that with everyone, and we gave out Chromebooks. We had a huge supply of Chromebooks. We were able to provide those for our students. Our parking lots had Wi-Fi, but quickly I saw that most of the students in our program, a third of our students are in health programs and had jobs already being offered to them as nurses, physical therapists, surgical technologists, radiologists, veterinary technicians, EMTs, paramedics, and others, many of the fields that we needed in our world to fight COVID. And so instead of us closing down and staying closed down, for us, I knew with our accreditation requirements, which are very different than the school systems, we had to get our labs up and going back in person, and we had to do it safely. And I do feel, based on the evidence of the number of positive cases, which I'll talk about in a minute, that we have done that. We graduated. We had more graduates last year than we did the year before. Big part of that was our spring and summer graduates, which were included in the count. And we were the first technical college of 22 to petition to the state of Georgia to bring students on campus to do the in-person labs. And my team did that. VP Henry's on the call. We screened students. We took temperatures and screened them and had them come in. We'd given our PPE away to the state, to Piedmont Athens Regional, which are great partners to us. And we had to get it back. As far as not from them, we had to go out and find it. And I give my team the credit for that, which VP Henry led. He has many years of experience in emergency management in the state of Georgia, and that was critical for us. We quickly got our PPE back, K95 masks, KN95 masks, the nitrile gloves, and hand sanitizer, and all of the things that we needed to do. We set that in place. We limited our size. We changed how we delivered the courses as far as the numbers that were in the labs. We didn't have more than 8. We've now upped that number, of course, and that has worked out well. But we implemented, in addition to the flu clinic, we implemented all the PPE, the signage, education about hand washing, because I quickly found out that people really didn't know about proper hand washing. We upgraded all of our Hepa filtration systems. We installed plexiguards, sneeze guards. We are looking at retrofitting all of our toilets that have handles. We are also doing that with our sinks to go to where touchless. In addition, something that we're doing that I wanted to share with you that may not be right for the school system, but it was recommended to us, and we also implemented air purifiers. But as I looked at air purifiers and as I looked at our cases that we had, which were minimal, I really heard more and more about bipolar ionization technology. And for us, I didn't know a lot about it, but I've talked to a lot of experts who recommend it. Those can be hooked up to our HVAC systems in each building, and that's what we're working on right now. The ions remove the small particles from the air, and what occurs is that some of the particles are so small that positive and negative ions, they charge those smaller particles and cause them to clump together. That's not the right term, but that's the term I understood, so I'll share it with you all. And when they clump together, the cleaning process can occur, and that does remove COVID. It removes viruses, and I have checked that with experts. I was able to speak to an expert in the US, one of the top 5 experts on COVID, and they did recommend this technology that we are in the process of moving forward with. Our cases have been, and one of the studies that I looked at where this technology was used, there were 340 participants living in a home that did not get the flu shot, that ended up with the flu one year, and the next year, same, no flu shot, and only 2 got the flu out of from use with this technology. So for that group, it was more affordable for them to implement the use of this technology versus giving flu shots. We are doing both. We had, by the time I checked with our flu clinic with VP Henry, within a couple of hours, we had over 100 people that had gotten their vaccines that are going to come back and do it again. But I will share that we've had challenges like anyone else that has opened up. We worked and shared everything we had with Albany Technical College, our sister technical college, because at the beginning of this pandemic, they were hit so hard. And what we have learned for us with our positive cases, and we have a very low positive case ratio. We've measured since the beginning of fall term. I want to disclose openly, we do not have testing on campus. So let me be very transparent and disclose that. However, we have encouraged, and VP Henry has found where students and faculty and staff can get tests. And we have encouraged that. And we've had a large number of tests occur on campus, but our positivity rate, the students self-report, and they've been really good. You have to remember, we have about 1/3 of our students with health backgrounds, and they are very committed to the health fields. And then we have made sure that the students know they're not going to be penalized. We're going to work with them. And so right now we've just reached around a 1% positive rate for fall term, just barely reaching that. And so we're going to continue. We're seeing our numbers continue to go down, and we're going to continue to work with that and work. But for me, there hasn't been one answer with this. We've social distanced. Our students have been fantastic to wear their masks. And I really, that includes our dual students who are on campus. We have only had one student who signed up for an in-person course and decided that it wasn't necessary that they wear the mask. They had no reason, medical reason to not wear it. We do have 8 students that are practicing in the vaccine trials with Moderna, which I bless them for doing that. And there's some stipulations with that. They can't be masked up, but with that kind of a study going on. But other than that, our students have worn their masks. And we have about 40% of students who are taking classes online, about 60% who are in person. But you have to remember about 15 to 20% of that 60%, they are in clinicals away from the college at UGA Small Vet School, at local hospitals, performing their required clinicals. So we don't have all the answers. I will tell you right now, we have learned every day has been interesting. I've relied on science. I've relied on the CDC, DPH, but they have been godsends to help us. But I will tell you that for us, the positivity rate, as we've measured, because we're reporting the students who are online that have positivity rates, and we're reporting the students in person, the positivity rates for us have been higher with the online. And for us, I will tell you, when the students are there, I feel very confident that we are providing the safest environment that we can. Our team has worked really hard. Nothing is the same. If it's the same, I start looking at it, because it shouldn't be the same. Everything that we do is a little more difficult and a lot more steps. We offered a virtual honor ceremony. We offered a virtual graduation ceremony. We've had no gatherings that we weren't social distance. I don't require those. We did hold a smaller in-person graduation ceremony where we registered everyone, and it was smaller. A lot of people chose the virtual. We held that at the Classic Center. They deserve kudos. We paid a cleaning fee for each person, 100% mask wearing, no handshaking. The graduates sat with only 2 family members, no exceptions. We social distanced. We had staggered arrival times, staggered departure times. And from that, we registered every person, and I checked with the CDC and DPH because, of course, I wanted to know the outcome of that event. And we didn't have a single case that came up from that event, which shocked me, because I felt like that maybe people would go out after that event, and we couldn't control that. So I expected some numbers. But I do want to say that for us as the technical college, bringing our faculty and staff and students back on campus has been a positive thing. We had some faculty who were very, very anxious, and we shared and communicated all of the items that we had put into place and what we were requiring. And we had some faculty that sent message to me or came by my office to share that they were so glad to be back on campus, and they felt it was that it was safer than they thought it was going to be. So I understand the anxiety. I've ordered stress balls for all of our team with ATC logo and smiley face, because I will tell you, I know in myself, and I know for my team, and I know for the students, I sense a little COVID fatigue where everyone is tired of this, and it's caused a lot of anxiety. And our support team has been fantastic. And yes, we've had more cases of support to provide regarding potential suicides, regarding mental illness. But I will tell you that while we aren't all things to all people, we are meeting our mission of workforce development. And I've had to stay focused on that, because during a pandemic, you're presented with a lot of things beyond your control. And I know for me, I've talked with the medical team. I've spent hours with VP Henry, and I want to stop. I know he's audio, but Glenn, can you hear me? Can you speak? Well, I know he's listening. And so if he has anything different to share with me, he can text me and I will share with you. But at any rate, I did appreciate the call from you all about the opportunity to share what we're doing. I do want to add, we were taking everyone's temperature, and we have stopped doing that. It worked out great in the beginning. People felt confident about it. We didn't have a single person that presented with the temperature. We do have a response, and we did that for all of spring term into summer term. It made me feel better. It made some faculty feel better and staff, so we did it. I did have students tell me, Dr. Daniel, I didn't do this, but all I had to do was take 2 Tylenols if I really wanted to come to class. I wouldn't do it, but you do know that. I realized then that really was a futile exercise for us. So we stopped doing it. But I do know that all of the actions that you can take make people feel better about the situation that is beyond our control. But I do feel good about what we've done. It hasn't been perfect, but we've worked with some situations with CDL where we're teaching truck driving in a truck where we're having to drape the truck and clean it. I've hired extra COVID cleaners, and some people say, well, that doesn't do a lot because you can walk in the door and someone has COVID and you've already cleaned, but the bipolar ionic technology is going to help with that. But for us, it's doing all of these. It's doing all of these items, and we're still looking for more. Faculty, we had everything taped off, and some of our general ed faculty, being the great experts and communicators that they are, they said to us, why don't you put the signage down that says stay 6 feet apart instead of just using tape? So we implemented that as soon as possible. As far as transitioning our students that were dealt this blow with the pandemic, we made it available to give them a Z grade. Doesn't hurt their federal financial aid, doesn't hurt their GPA. And so they could opt to do that early in the pandemic, and many students did select to do that. But that's just a quick synopsis of what we've gone through over the last few months. I will tell you, it feels like we've been doing it quite a long time. I know that the simplest task that I asked my team that used to be 2 steps, they're now 10 to 15 to 20 steps, but we have to do it. There's just no way that we can stop doing that until we get to a better place to offer the vaccine on campus, and then continue to social distance and wear our masks. But I am proud of our team, and I'm proud that we've continued on. It is difficult. And I do know that Dr. Thomas, I know you all appreciate this. She's in a very difficult situation because whatever I decided, you were going to have people that are anxious either way. And and she's shaking her head, yes. What I decided is that for us, we had jobs and lives. I felt lives were dependent on this. I still do, not just because we teach health programs, but because we've had students on campus who have been suicidal. And had they not been, we might not would have caught their issues to be able to work with them and to help them get the resources that they need. It's not right for every student. For students that I can't stress enough how giving students the choice, that's so important. If it's right for them to be at home, then it's right for them to be at home. But if they want to be face-to-face, we want them face-to-face. We opened up our library right after we did the labs. I made the library services available, and we did that at first by carrying items out to students. And then we set up appointment times. That worked really well. We've gotten to where now we have a little more experience in working with it, but things have gone well. I'm really proud of the team. Hasn't been perfect. It has not. We've learned a lot. The one thing I haven't mentioned that I did mention the other day is in the beginning, when you do come back and you have cases, people tend to panic, and I understand that. A case was reported on campus, and I was asked, how do we know where he's been? He could have been everywhere. Our library's open, our student center's open. How do we know? We have surveillance cameras, and that was instrumental in looking to see who that in the contact tracing with students and who they had been around. In a lot of the cases, because we were limited, they had not been anywhere else. They came straight to their lab, did their work, went home. So we were able to contact them and handle that. But those are just some of the items that we've experienced, and I in no way want to say that we mirror the school system, but I hope that some of what I've shared today will be helpful to you. And Dr. Thomas can call us at any time. We value this partnership with the Career Academy and with the school system, and know that Dr. Thomas, her team, is working very diligently behind the scenes with all the aspects, as you are as board members. But anyway, I will stop and see if there are any questions.
I just want to thank you, Dr. Daniel, for what you all have done to support our students at the Career Academy, those students who are dual enrolled, and we're working diligently to make sure that their learning is uninterrupted this fall, so that they can continue to move forward and earn those additional credits either towards high school or college. So we thank you for your flexibility in allowing them to still be enrolled in your program, but following our models.
Absolutely. We enjoy having the students. They are refreshing, they are intelligent, and they bring a lot to our campus, and they bring a lot to our programs. And so that I pledge to you will continue as we go forward. Any other questions?
I had a quick question, if I could, Chair Davis.
Yes.
Could you expound a little bit? You mentioned that y'all had installed Hepa filters.
Yes. Well,
Okay.
we have the Hepa filters that have the highest filtration system possible that we've added in some of our buildings. But, as I stated, some of those filters, the particles are too small. Whoops, did I lose you? The particles are too small to take care and remove the particles, the infected particles from the air. So in addition to the filtration, the highest level of filtration, medical filtration systems that we can use as far as filters, that's where I've looked at wanting to add the ionic technology that I believe from experts will help us to be able to cleanse not only the virus from the air, but other viruses and mold and bacteria.
So are these are filters that you put into the HEPA filters, were what you put into your existing HVAC system?
That's correct. And then this ionic system, it's a unit that you hook up to your HVA system. And some buildings take 2 units and some buildings take 9 units. Depends on how your system, HVAC system, is set up. But I won't pretend that the filter systems that we've put, the filter changes will take care of everything. I know it doesn't. It's helped, but that's why we're adding this ionic technology, which I believe will go I know it goes a step further, and it will kill the viruses that are, COVID, influenza, other viruses. And I really am hopeful that we're going to have a much better fall and winter than we've had in the past. We've had cases of the flu at the college that we've worked with, and it's been quite extensive in years past. So I'm hopeful with the flu clinic and with this new technology and all the other items that I mentioned that it will help us.
Yeah, I would, what I would like, and thank you so much for that, Dr. Daniel. I wanted to kind of use that as kind of a safe way to explain that, the way, at least from my point of view, that, the school district, UGA, Athens Technical College, can really do a lot to protect students and staff within the buildings. But, as I was talking to Dr. Thomas, I mean, that what we cannot control is what's outside the building. And, you alluded to, at least the data that you have with at least a little bit of confidence about students who are virtual, more susceptible to the virus than the students who come to the building every day and have that structure and have that safety. Pro Tem Edwards, Mayor Pro Tem Edwards. I wanted to see what where is the county at in terms of kind of trying to keep a handle on what happens out in the community outside of UGA, outside of Athens Technical College, and outside of CCSD.
Well, we're mostly focused on the mask mandate that we passed some months ago now, I reckon. And we've distributed thousands of masks. I think 5,000 or 6,000 masks the police have handed out downtown. We've also distributed them on buses throughout the transit network. So that's really been probably the most successful campaign that we've waged, is to go ahead and pass that mask mandate and then follow up with the mask distribution. I think that's probably been one of the most successful ways that we've brought down transmission. We get complaints about big parties and large gatherings, and the police do visit some of those events and talk to folks about the noise ordinance. The noise ordinance has really been the chief vehicle to try to clamp down on some of these big outdoor large gatherings, because the governor's order, prohibits gatherings 50 or over, but if they're transitory in nature and as long as people can socially distance, it's just very, very difficult to enforce these provisions. So we haven't enforced any sort of gathering ban through the governor's order, but we've tried to focus using the noise ordinance. And then we've also sought to just encourage safe practices within our locus of control within county facilities, requiring masks, social distancing, etc. And then I guess the latest thing, we are working with Dr. Erin Lipp from the Center for Ecology and Infectious Diseases to expand her wastewater testing. We've seen that the wastewater testing of COVID load has been a truthful way to understand the parameters of the pandemic. As Dr. Adams mentioned, the antigen tests are not included in the case counts. Also, folks who never get a test or who never self-report through UGA, those aren't tracked within any sort of public health data. but the wastewater doesn't lie. So, so we are working with Dr. Lip to expand collection into another one of our wastewater treatment facilities, and also spot check other multifamily housing units around town to try to get a better handle on the scope of the pandemic by testing the wastewater.
Well, the one question that I have, this Zoom technology, if anybody has a question, just raise your hand or do something, because I don't. It's hard to figure out. But one thing that I was talking to someone that's involved in the catering business, and you know, there are large groups of folks who are gathering together for weddings and things like that. And I know you mentioned the noise ordinance, but I guess if it's in the afternoon and if it's in someone's backyard and it's 200 people, there's provided they don't hoop and holler. I mean, if it's just a kind of a wedding reception, there's a limit to what the county government can do.
Well, and we've got tens of thousands of people who are gathering in Sanford Stadium. So, obviously so we're going to go drive up the party and they're going to point at Sanford Stadium, so there's certainly some mixed messages happening. And so we've found probably, encouraging people to be outside is good. We're mostly concerned about large indoor gatherings where the air is stagnant and people are sharing air. That's why I was so happy to hear about Dr. Daniels and her, air filtration, science-backed strategies. I think that's smart.
And I did, my VP did text me, the filters that we use are MERV 13 filters. So you can look at those. Again, I do not think that's the, end all be all, hence the bipolar ionization technology that we're adding. I think it's going to take all of that. The only other thing that I would add is I do like the outdoor, a lot of activities that we have in physical therapy. They're going outdoors. We encourage people to get up and go outdoors. And we did change some classes to hybrid as well. So I find it's a combination of all those factors. But I did want to share the MERV 13 filter information.
Is that
it's helpful? Yeah.
Russell, what about in terms of our eating and drinking establishments? Is some of this technology encouraged? Is it feasible? Is it something that could be utilized, seeing that, we obviously want the economy to keep on, but is this something that the county government could influence businesses, particularly restaurants and bars, to look at the ionic technology or upgrading their filtration system, or putting in?
Sure. Yeah. I think so. And we've taken a direction of, expanding outdoor spaces for businesses with our parklet program on College Square and Washington Street. So we're encouraging people to go outdoors. Also, we've been enforcing the governor's occupancy standards for bars and cutting down on indoor areas that are crowded. But yeah, that point's well taken. I think for most of these places, to retrofit a powerful filter can bog down a traditional HVAC motor. But I know for my shop that my wife and I own downtown, we just purchased a standalone HEPA filtration machine that, it helps some. It doesn't capture every viral particle, as Dr. Daniels says, but it's it's all about layering safety protections, I think, and when you have masking plus a HEPA filter, I mean, it's just one more layer of protection.
That's right.
So,
And the MERP filters, one of the reasons we went with them early on is it did not require that we retrofit any of our systems. So that was a positive. But as I looked at more and more, the bipolar ionization technology is not quite as expensive as I thought it would be, but it's still, you know, a cost to us. But if it'll save lives, we'll be glad to do it.
Yeah, I just don't know what, you know, what the restrictions are in terms of county government encouraging bars and restaurants to spend money. I don't know in terms of something like this. So
Sometimes it's just providing the tools. If they know they can use a filter system that doesn't have to be retrofitted, they might be more open to it. Because when we first looked at it, I said there'll be no way that some of our systems are new, some are older. But when you find something that doesn't have to be retrofitted, that might be an encouragement.
Mike,
Mr. Edwards,
yeah, introduce yourself first, and then.
Oh, thank you. Yeah, I wanted to ask Commissioner Edwards a question. I'm Mike Pruitt. I'm the board attorney for Clark County School District. Commissioner, I noticed the last two extensions of the governor's emergency order declaration were only roughly 15 days at a time rather than the usual 30. And I wondered if you had, I know you keep up with this, I wonder if you had any insight as to what's going on in the Capitol and what we might expect.
That's a good point. I don't have anything for you off top, but I'll look into that and try to get back to you. That is odd that they would only extend it for 2 weeks at a time. And I know for a while it was in 1 month long chunks.
Yeah, the maximum is 30 days, but I noticed he's now doing less than that.
It's been a challenge for our government. Yeah.
Yeah, we're
Yeah, that's curious to me. Interesting. Yeah. I mean, it gives the appearance that, oh, we're getting through, you know, we're almost done, you know, just break it up into 2 week sections, you know, maybe in 2 weeks we'll be okay, right? I mean, that's kind of the appearance it gives to me.
Now, there's one thing that
Good question. I'll try to find that out, Mike.
And the success in terms of limiting the hours of downtown, that there are limits to what we can do, Russell.
Well, we did, you know, successfully move up last call to 11:30 p.m. So what once was 2 a.m. last call is now 11:30. So we were able to cut back on some of the sort of the large bar business, which is some of what we've seen in other countries, other areas. They've switched over to rein in bar hours last call. It's happened in other places. So, I mean, we're pushing, you know, no, I don't think any other government has moved up last call. We were the second government to mandate masks. So we're always looking for new opportunities to encourage good pandemic practices by our citizenry.
But there is one thing I wanted to share about UGA that when I talked to Allison today was apparently Greek. If you're able to follow their rules in the Greek community down Millage, which includes no one who if you live in a fraternity, then you can stay. If not, you're supposed to be out by 7 in the evening. And if you follow the rules, then in the spring you get block seating for your fraternity, which apparently at the football games, which is apparently a real big deal. So that's their inducement. I'm when, you know, talking to Dr. Daniels, it just seemed like a lot of what they've instituted in terms of this equipment, this ionic equipment, standalone stuff, may be something that businesses can be encouraged to do if it has any effect at all. It seemed like it'd be worthwhile. But
And the schools, of course. I mean,
yeah.
I mean, one thing that's good about that ionizer that I understand is it pre-treats the air to increase the size of the particles so that they will be caught into the filter. So you don't have to worry about putting a stronger filter that might bog down your system. You can use the ionizer to increase the size of the particles while using the same filters.
Do we have an
That's
idea?
correct.
Do we have an idea, Dr. Daniel, about what the cost is for something like that?
Yeah, I'll quote the company that we're working with. They have two different units. One unit is around $2,000 to $2,500. Another unit is around $1,500. The issue is one building that I have is going to take 3 units. Another building I have is going to take 9 units. I will tell you that if the school system has CARES funding, that is an allowable expense, and we're utilizing CARES funding to be able to purchase it. Where we also have, I didn't mention, we have the Disinfectant Foggers, and those are great. We have the ones you can work with electronics, but I'll tell you, they're very expensive for one room. For those, you're looking at $150,000 for one room. And the issue is that what you and I discussed. So you've got the room all cleaned and everyone walks in the door with someone breathing out COVID, and that's asymptomatic, doesn't know it, even though they've got a mask on that we're requiring. Say a small particle gets through, then this system will allow it to be cleaned in the air, as Russell Edwards described. And there's technical terms for it, but those particles are so small, and that's exactly what he described. It makes the particles clump together larger so that they can then be filtrated, and that you can, it's a small box. It's not a huge unit, and it's not hard to, they're not hard to get right now. There's no waiting list. And the company comes out and hooks those up for you. The demonstration for our team occurred, and we were very pleased with it. And I saw very quickly I was not going to be able to get $150,000 for every room versus a building that requires 3 of these units, or say 9 of these units. For us, we're doing them in the entire campus and the entire other campuses that we have as well. So it's affordable technology for business. If $2,500 may be a lot, but if they are able to hook up, or $1,500, but that's, it's promoting a healthy environment to their clients, to their customers, and being able to put up signage that they have taken extra steps. And I did check with the CDC about this technology. I did check with some experts. I did talk to some COVID experts, and they highly recommended it. And so we're moving forward to do the entire campuses. We're started with our labs. That was the thought, but I have said we're going to do it in every single building, and we're going to keep doing the others. I want to be clear. Somebody said, so we get to take the mask off. I said, no, masks stay on, hand sanitations, everything else we're doing. This is just another layer that really protects and helps. We're not controlling the outside environment, but we're controlling what may be brought into us inadvertently by someone.
It seems like it would be worth, if you could, sending the information of your purchasing to either one of us, and we can forward, or to Dr. Thomas directly, and she can provide to Mr. Fisher. I know Mr. Fisher has talked extensively about the changes that they've made to the district HVAC systems, but I don't think we've looked at this option as far as I've ever heard him say. Nor can we afford to replace all of the filters in all of the buildings with the very, very high-end medical grade filtration, because it's just too expensive. We don't have anywhere near enough money to do that. So
right, we'll be glad to share the
technology.
information.
Sounds very, very helpful. Thank you.
Well, I think in one thing about what Dr. Daniel's explaining is that this is not just for the pandemic. This is an investment in air quality that will last, for the life cycle of this upgrade, and
Yeah.
will serve to cut down on spores, influenza, anything else.
Mold, yes, absolutely. That was an attractive feature of it, that it creates a healthier environment for not just COVID, but additional air quality, which is so important in an indoor building.
Yeah. Okay, that's good news.
Other questions, comments? Yeah, I guess I'm one thing that we're kind of getting back to is what type of messaging have we not tried in terms of everything from purchasing additional equipment for our retails, for our for our classrooms that Russell's talking about, but also in terms of just seeing that mass gatherings of folks, it's not really a good idea unless you can safely distance and wear a mask. And you very well can't do it if you're at a catered event for 250 in somebody's backyard. So, I mean, for someone who can afford to cater an event like that, I mean, it's not a lack of getting hold of a newspaper or and finding out what's going on. So that was one of the reasons that that we selected this topic, is to just try to see what else we can do. I know that people are really tired of kind of staying in place and pandemic fever, so to speak. I know I am, but it's a with the opening of school, which seems like a necessity from what we've heard, both from a lot of our teaching staff, a lot of our, but more particularly from the students that we haven't heard from, and the parents we haven't heard from. So, any other suggestions about how we message safety?
Well, I think, the school system is an important institution for the county. So the measures that y'all take have ripple effects throughout. So I think it's important, how y'all mandated masks, that reinforces the county mandate, that shows that we're all cooperating, Athens Tech mandates, so it's like all the responsible institutions in town are mandating masks. UGA mandates masks. So, I think in your role on this committee and in your role on the school board, the safety practices that y'all adopt help serve as a model for the entire county. So I think it's really great that we have Dr. Daniel here, who seems to have, a success story in opening up Athens Tech responsibly, and some good information. I mean, the roles that y'all play on the board and the actions you take, influence businesses and other institutions throughout the county.
Yeah.
So no pressure. Yeah.
I have a question.
Yes.
Dr. Daniels, did you have any sick faculty, or did you have to deal with people that got sick from these practices? You said you had a 1% positivity, but you didn't talk about any sort of catastrophic illnesses that kicked in. I know there's you mentioned the fear and the anxiety, but was there a reality of anyone getting sick?
The only people that I had that were sick, faculty wise, were the majority. We did have a few. It was while we were shut down and they elected to travel, and they were never on our campus, and they traveled out of state and came back with COVID. We have had a couple of cases where we've had many tests, many tests. We have had a couple report positive, but really not more than a couple. So I saw early on, I felt that our faculty and staff were safer at the college under all of the not traveling to Las Vegas. We had a faculty member that decided to travel to Las Vegas, and that was their choice. We were shut down and they could do their work from home, but they contracted COVID. I will share, for me, it was very difficult. Had a colleague that was very close to contract COVID-19, and was the president at North Georgia Technical College, President Mark Ivester. And he contracted COVID-19 and went into the hospital in the ICU. He never came out. So he did die, and we miss him greatly. And that was such a huge loss, 57 years old. So but he did all the right things at his college. And that was very, very opening for me. And I miss talking to him weekly. So I've had that experience and know about losing a colleague and someone, a great friend. So I understand how serious this is. I really, really do understand that.
Antoine, you have a question or a comment?
I guess it would more so be a comment. I guess you guys already know where I stand on this, but
Introduce yourself
still more of
yourself
the
first.
erring on caution when it comes to this, especially being a person that has a lifelong genetic disease. I know I'm having to watch every single move I'm doing right now. So, but I'm still on the side of erring with caution, specifically because of what I'm seeing just in my district. I know off the top of my head, I can name you 5 people who I know are still in the hospital right now with COVID. And of course, I represent the most minority district on the school board, and that's the community that's still being very, very disproportionately affected by this thing. So I'm listening, standing aside, and just listening to where things go from here. But I'm still very supportive of us heading in the direction of exploring pods and outdoor learning and what we can do there, because we do operate with kids, which is a little different from what I'm hearing from the colleges, where they have that success going on there, because those are adults at the end of the day. So it's a little more serious for us, a little different situation.
And I will add, 70% of our students are under the age of 25. We do have a significant population between age 16 and 18 attending. I do think that a message, you would think at a technical college that offers all the health programs that we offer, you would not need to do a public message on hand washing. But I will tell you, I learned from that, and others did as well. So I do believe messaging is going to continue to be important. And you think some of the things are so simple, but they've got to be marketed and messaged out. We don't have K through 8th grade, but for us, a lot of our students do have children. I'm going to tell you, for us, it has been good to have the students back on campus and proceeding. I do agree with caution. I think everything has to be with caution. And I don't think it's right for all of the vulnerable population, but I do think the choices that we've given our students have been important for them to continue to move forward. We have hunger on our campus. We have a pantry, and I know the school system's providing food, but we have a pantry for food and clothing, and we have assisted a lot of students with that as well during this time. And then the issues of support, we continue to provide that. So for us, we're a different population, but it has worked well for our students, and the choices are important. Having online, having engagement with online, we had a lot of changes to do with that. but having in person has been important as well. So there's certain programs the state will not let us teach online. So we've had no choice in that regard. We wanted to continue to teach them, and you can't, it's hard to teach welding online. It's hard to teach certain medical procedures, how to insert a tracheotomy online. We have students that are hands-on and are doing it, but I do appreciate the comments. I think that the caution, I'm constantly looking at everything we have with caution, every event, even feeding our students and how we feed them with pizza or hamburgers, which is important. Doing that outside, doing that social distance, wearing a mask, encouraging, have people walking around, encouraging that. It's a lot of effort. I'm going to tell you, it is. It's worth it for our students. But the work when you go back is much more than what you had prior. And I applaud all the educators who are going to do it on online and in person. They're both extremely challenging during this pandemic time where people are anxious and have the right to be anxious.
Mike, you got something?
No, I'm just not. I'm just thinking I really appreciate Dr. Daniel spending this time with us today. This has been a lot of solid information.
Yeah, it really has. Really been very helpful. And it's given me food for thought, in terms of some of this technology. And also, Dr. Daniels, Dr. Daniel, your use of shields has been kind of interesting too, if you want to mention a word or two about that.
Well, the plexiguards, we put up those for just the front line, and then we saw quickly that we could put them up in stations. We're looking at putting them up in between the students, but we also made face masks for medical providers and have students that have worn face masks in addition to the face shields, and in addition to the masks, we have a drafting technology program, and they are able to make them. So we've been fortunate in that regard. We just continue. We're a technical college. We continue to look at technology. We continue to look at the science and get good advice from others. I've got a lot of microbiologists on campus and chemists that I can run to and ask questions. We use UV lighting quite a bit. And so we're just using every tool. And that's what I want to say that I've learned from this. I've written in my journal for the next president a little tab regarding pandemic, and a lot of it will include technology and deep breaths, and take it someone said, you're taking it a day at a time. And I said, no, we're taking it an hour at a time. But we continue to move forward, and our students, I'm really proud of them. And I know that the school district is going to do this really well because of all the hard work. And we're there to help. If anybody has any questions, we'll be glad to share any of the information I provided today. We do not have all the answers. I don't want you all to leave and think we're perfect. We've just been doing this a long time, since May, and we didn't have everybody back at once. We did a phased in plan, but we've been doing it a long time, and it is a different population, and I do understand with age, but I'm hopeful. I know that the school system will be successful and moving forward. I'm confident with all the hard work.
Any more questions or comments from our board members or?
No, just thanks. Thanks for all the information and the perspectives.
Thanks for having me today.
Well, thank you so much. And we will leave a few minutes early if there's a motion to adjourn.
So moved.
Is there a second? Thank you.
Bye, everyone. Thank you.
Thank you.
Bye.
Thanks, everyone.
Thanks, Greg.